and specialized tools, so not too many people ligated in the 19th century. So then another approach to amputation was developed, and it's called the flap method. The flap method is unfortunately multi-step, so a lot more misery to endure, but it does result in a completely enclosed wound. The first blade that was engaged is the Catalan, which is this double-edged knife. This was used to make a swift V-shape incision through the flesh and the muscle, cutting it down to the bone but not severing the bone. Then that flap of skin would be rolled back much like a sleeve to expose the bone a little further up. Then the bone saws. So here's some beautiful examples of 19th century bone saws. These were most likely purchased at the local hardware store. They're just old, durable blades. They just had to cut through the bone, that's all they had to do. But inevitably this would result in a lot of fracturing and splintering of the bone. So typically the surgeon had at their disposal a whole bevy of forceps and tweezers. This one is literally called the bone gnawing forceps. So this was used to clean up the protruding surface of the bone post-operation, and then the small tweezers were used to extract the bone particles that had become embedded in your tissue. Once all of that was cleaned up, they would take that flap of skin that had been hanging out, and they'd fold it over and sew it up. So then you were completely enclosed, blood loss was curbed, and then you could attach a prosthetic. We do have some Civil War era suture needles right there. They don't look that different. So there was some benefit to that method. Unfortunately, in neither of the methods were people typically sterilizing. So for the most part, amputation did become gangrenous, and the treatment for infection was amputation. So amputations tended to have to progress. It was something that was a recurring experience. Once you had one amputation, typically you had to continue to go back for more, which was maybe some sort of sick job security for the barber. He's like, see you next week. All right, so if you